Hello everyone, this is Vamshi Krishna. Welcome to my YouTube channel. Today we'll see some of the basic questions for upcoming staff nurse recruitment examinations. So the first question is, umbilical cord becomes visible at the age of. Options are 30 days, 28 days, 4 months and 8 weeks. So the right answer is, at the time of 30 days, the umbilical cord can be visible. So the next one is organogenesis occurs at. So when the organogenesis are start. Options are 5 weeks, 6 weeks, 8 weeks, 12 weeks. The right answer is 8 weeks. So at the time of 8 weeks, the organogenesis will be taking place. Organogenesis is nothing but formation of organs. The next one is first fetal movements are felt at the age of. Options are 16 to 20 weeks, 28 weeks, 30 weeks, and 25 weeks. The right answer is 16 to 20 weeks. So, in this period, the fetal heart sounds can be felt by the stethoscope. The next one is that the testicles are descended at the age of. So the testicles are moving from the abdomen to scrotum. That is nothing but descended. Options are 35 weeks, 36 to 40 weeks, 40 weeks, 38 weeks. The right one is the 36 to 40 weeks of gestation period. The testicles will be uh, coming downward from the abdomen to scrotal sac. The next one is a presumptive signs of pregnancy except one. So here I am asking presumptive signs. Okay, one option is not a presumptive sign. The options are amenorrhea, morning sickness. This is not a sign. This is sickness. Osiander sign and breast discomfort. So the right answer is Osiander sign. Osiander sign is nothing but it is a pulsation of the vaginal area, that is called Osiander sign. So these three are the presumptive sign. This is the probable sign. The next one is a probable sign of pregnancy except one. Options are Braxton Hicks contraction. Option B, Gödel sign. Gödel sign is nothing but softening of the cervix. And the next one is the Jacomeyer sign. This is nothing but purplish color of vagina and cervix. Option D is the morning sickness. So the right one is the morning sickness. Option D is the right answer. This is presumptive sign. These three are the probable signs. The next one is a fundal height is at umbilicus in the age of. So in the mother, the umbilicus is and the fundus is near to the umbilicus. So in which age the fundal height is near to the umbilicus? The options are 18 weeks, 16 weeks, 24 weeks, and 36 weeks. The right answer is option C. So at the time of 24 weeks, the umbilicus, the fundal height near to the umbilicus, uh, we can see the chart over here. At the time of 16 weeks, 3 fingers width above the symphysis pubis. This is fundal height. And at the time of 20 weeks, it is 3 fingers width below the umbilicus. And at the time of 24 weeks, it is near to the at the site of umbilicus. And the 28 weeks, 3 fingers width above the umbilicus. 32 weeks between umbilicus and xiphoid process. At the time of 36 weeks, it is at costal arch. Costal arch is nothing but it is near to the ribs. Okay, and the next one is 40 weeks. It is 1 to finger width between below the costal arch. So this is the right answer. That is 24 weeks of gestation. The fundal height will be at the umbilicus region. The next one is how much ml of amniotic fluid at the age of 12 weeks of gestation. Options are 60 ml, 50 ml, 40 ml, and 80 ml. The right answer is 50 ml. So at the time of 12 weeks of gestation, the amniotic fluid will be 50 ml. So the next one is how much ml of amniotic fluid at the age of 20 weeks of gestation. Options are 200 ml, 400 ml, 600 ml and 300 ml. The right one is the 400 ml. The next one is labor can be assessed by. So during the labor process, the nurse how she can be assess the labor process. Options are Apgar score, Partograph, TPR or CPR. The right one is a Partograph. So by using of Partograph, we can assess the labor that is cervical dilatation and fetal heart. So some of the components will come under the Partograph, which is related to the labor process. The next one is the stages of labor. So how many stages of labor will be? Options are 1 stage, 2 stage, 3 stage and 4 stages. The right one is the 4 stages. There are 4 stages of labor process. First one is the cervical dilatation, second one is the delivery of the baby, third one is the delivery of the placenta, fourth one is the observation of the mother and fetus. So there are 4 stages of labor. The next one is the what is the fourth stage of labor? That is nothing but option D, that is observation of mother and fetus. The next one is the internal rotation stage of labor occurs after. So when the internal rotation will be taking place after the which stage of labor process. That is options are engagement, descent, flexion and restitution. That is flexion. So after the flexion we will go, the mechanism of labor will be internal rotation. Okay, so after the flexion the internal rotation will be taking place. So we will see the a mechanism of labor. So first one is the engagement, that is engagement. Descent is nothing but the baby will coming down, and the flexion, internal rotation, crowning, extension, restitution and external rotation. External rotation and expulsion of baby by lateral flexion. This is mechanism of labor. The next one is episiotomy is done in which stage of labor? Options are first stage, option B second stage, option C third stage, option D before onset of labor. So it is conformably at the stage in the stage of second stage. So um, mm, before the head is coming out, the episiotomy will be taking place. The doctor will give an incision over the perineal region. That is episiotomy. The next one is the lochia serosa is in which color? So we have the lochia after the delivery. So lochia serosa is a type of lochia, and serosa is a type of lochia. So lochia serosa in which color it is looking like? Options are red color, yellow color, pale white and green color. The right one is a yellowish color. The lochia serosa will be yellowish color, and the lochia rubra in the red color, lochia alba in the pale white color. The next one is identify the condition below showing in this picture. Options are placenta previa, abruptio placenta, ectopic pregnancy or all of the above. The right one is abruptio placenta. So abruptio placenta is nothing but premature separation of the placenta from the uterus. So here you can see the blood hemorrhage. Okay, this is called abruptio placenta. The next one is galactoria is known as. So what is the meaning of galactoria? Options are no milk secretion, less milk secretion of the milk, and C is the excessive inappropriate milk secretion. Option D is the both A and B. The right one is the option C. So this is galactoria is nothing but excessive and inappropriate milk production. Okay, this is called galactoria. The next one is a gossipol. So what is the meaning of gossipol? Options are option A female contraceptive, option B male contraceptive, option C both A and B, option D none. None of the above. The right one is a male contraceptive. So it is directly suppress the seminiferous tubule causes azoospermia. Azoospermia is the absence of sperm production, that is called azoospermia. So gossipul is nothing but male contraceptive. The next one is the full form of HELP. HELLP. So what is the full form of HELLP? Options are hepatitis and low liver enzymes, hepatitis and low liver enzymes, hemolysis, high liver enzymes and high platelets, hemolysis, high liver enzymes and low platelets, hemolysis, elevated liver enzymes and low platelets. So the right one is the option D. Option D is nothing but hemolysis, elevated liver enzymes, and low platelets. So there is no a perfect reason of occurring of HELP syndrome. The next one is the pH of vagina during pregnancy. So how the pH level of vaginal canal during the pregnancy? Options are acidic, alkaline, normal, or unknown. The right one is the acidic. So acidic is near to the 3.5 to 4.5 pH level we can see in the during pregnancy. The next one is a replacement period of copper T200B. Options are 5 years, 10 years, 15 years, and 2 years. The right one is the 10 years. So for a for each 10 years, the replacement will be wait a second. Okay, sorry for this. So replacement will be taking place for every 10 years. That is copper T200B. The next one is a how much ml, not this is who, this is how much. How much ml of milk produced in a day of a mother? So in each day, how much ml of milk will be production will be taking place of a mother? Options are 1500 ml, 1200 ml, 1000 ml, or 500 ml. So the right one is the 1500 ml. So 1500 ml of milk can be produced in each day in the human being. So this is my end of my class, guys. Thank you for watching.